If students can take their masks off when they're at their desks or at their workstations in the classroom, to me, this new mask mandate doesn't really seem like a change from the old order. So maybe I'm missing something. Can you give me a couple of specific in-school examples of where a student will now have to wear a mask when they didn't before?
Well, I would say when they will be required to wear a mask when they're entering their classroom or learning space, if they are engaged in any sort of group work or discussions, if they're getting up from their desk to move to get a drink of water or to do anything, to move around the classroom, and that those provisions are consistent with I think what we see in office workplace settings for example.
Shannon, do you have a follow-up?
They said that PE should happen outside whenever possible. My child just went through PE, and sometimes the weather was very, very difficult, and they were still inside the gym. So my question is, can PE still happen inside the gym, or is that now off? Because you said whenever possible. And if you can still do PE inside the gym, would kids now have to start wearing masks?
Do you want to take that one? Sure.
If you read the guidelines, there's a lot of detail about that. But what we have recognized is that things that were being held outside safely, when they move into the gym, people were not necessarily taking extra provisions to ensure greater space, mask wearing in certain conditions. So yes, there is some guidance, some more detailed guidance about how to safely have PE classes without having the intense physical activity that you can do outside more safely than inside. So it again aligns with what we've learned over the last months about this virus and how it is more easily transmitted in certain months of the year as well as in certain indoor conditions in particular. So it does provide, the guidance is about increased space, reducing numbers in a larger space, and reducing the types of activities that are more risky indoors.
Dr. Henry, could you explain or can you describe for us the need for the rapid response teams? What will they be doing that wasn't being done before to help support schools, and what was sort of lacking or insufficient about the initial response plans?
I think I don't assume there was something lacking or insufficient. It was more trying to find a way to enhance or better connect with schools and answer their questions in a rapid way. Of course, if you look back to November, particularly October, November, December, when we were having a lot of cases in communities, particularly in the Lower Mainland, but now we're seeing that in communities around the province, and it was a very challenging time for public health. And I had started a public health school liaison group led by Dr. Reka Gustafson and Dr. Jeff McKee now at the BC CDC on our behalf to look at what schools needed to help them deal with this situation, because we see more exposures when we have more cases in our communities. And that's why it's so important for all of us to continue to do our bit to stop transmission in our communities. That is what keeps our schools safe as well. So what we learned from that process was that having dedicated places to go, along with a checklist and a response that allows schools to know in a more rapid basis who to connect with and how to do that and what kinds of information will be needed on both sides. That was something that arose out of the consultations that were done by that team over the last few weeks.
Yeah. And just to add to that that period, for example, one of the ways in which we were trying to be more responsive in the field was in the Fraser Health Authority. The Surrey School District implemented a new exposure notification process to try to address some of the concerns around communication and around getting more information out. And we found that actually increased the number of notifications that were being sent to parents, and there was a concern that was in fact sort of elevating the level of information and anxiety. And so they went to revisit that. And one of the issues that Dr. Gustafson and her team have been looking at is this question of notifications and ensuring that we have some consistency across the different districts around how that communication communication rolls out. So it is very much a process of learning what is going to be appropriate and work in different areas. And so I'm very hopeful that the rapid response teams, once we have them, when we have them staffed up and in the different regions, will be able to continue to help just smooth those lines of communication.